we're going to do some range of motion to help get your muscles going. Alright, so first you're going to barely expose the patient. So I'm just going to grab her knee, try to keep her covered as much as possible. So we're going to go up 3 times, and you got to make sure that you're asking the patient if it hurts at any time. So does this hurt at all? And no. And then with an ankle, you're going to lift the toes up as far as they can go without hurting them 3 times. So you go up, up again. I want you to cover that. Alright, and this is range of motion for the shoulder and the elbow. So for the shoulder, you're going to support the whole arm, and you're going to go up 3 times towards the ceiling. And you're going to ask them if it hurts at all during this as well. And then you're going to move to the side 3 times. Does that hurt at all? And then with the elbow, you're also going to do that 3 times. 1, 2, 3. And then you're going to put them back under their covers, and you're going to sit your standard post steps. Hi. Right now we're going to learn how to do vitals. They're pretty simple. Their pulse, respirations, blood pressure. You would also ask them what their pain scale is at, what their temperature is and stuff. They're pretty standard stuff. So first we're going to take pulse, which is you hold onto the thumb side. There's an artery right through here. So you'd count for a whole minute and how many beats in a minute. It's pretty standard. Everybody kind of knows that, but so you do that for a whole minute. And then for respirations is the second one. Most places have an oximeter or something to make sure that you're breathing okay. Respirations this way, we just count how many times their chest rises in a minute. Usually it's from, normal numbers are like 15 to 20. It can be less, a lot of times it is less, but people are really relaxed. And yeah. Alright, so this is how you do denture care. You're going to take the dentures out of their mouth. You need gloves for this because you're touching bodily fluids. You're going to wash the dentures in lukewarm water. And then you're going to take a toothbrush, toothpaste, and emesis basin. This is a denture brush. It's special. You also need a cup of room temperature lukewarm water. You don't want any hotter or colder because they can ruin the dentures. So first I'm going to start out by putting the dentures back in their basin and putting the toothpaste on the toothbrush. And then you're going to cup the dentures like this, making sure that you have a really good grip on this. You're going to brush the top of it, making sure that you get in there too, in the cracks where the cement is for the dentures. And then you're going to flip it over, cup it again, clean the teeth nice and good. You should do this about 2 minutes like you do with your regular teeth. Just make sure that you get all the food and stuff out of there. And then the gums up here, everywhere. And then you're going to rinse everything. And like I said, you're going to fill their denture cup with lukewarm water. Put the dentures in there, and they can be kept in there for overnight. And that's how you do denture care. Okay, so this is catheter care. This part is inserted into the urethra. You don't take this out. It's painful if you do. You make sure you hold the top of it very firmly so it doesn't move around inside them. You clean from the front part all the way down to the back part. This is to prevent any infections that they could possibly get from the tubing. And then this part, to empty the catheter, you go and you remove this and point it downwards into a urinary output measuring cup. So let's say they had like 800 milliliters in time, which is a lot. You do that, and then you clean the end of this really good so it doesn't get all gross. And you shut it so it doesn't leak anymore everywhere. And then you would put it back into the slit. That's how you do catheter. Alright, this is sideline position. You're going to want to put the bed rails up. Unfortunately, this bed doesn't have any bed rails, so we're just going to pretend that they're up. This keeps the patient from falling off the bed. We're going to raise the bed to a safe working height. You don't want to break your back trying to do this. Alright, and then for sideline, we're going to be moving the patient to their side. It's kind of common sense. You're going to take the arm nearest to you, fold it across their chest, and then you're going to move them to their side. And you're going to take a pillow. Usually you have a partner doing this, or somebody else helping you. You don't have to. And then you're going to put the pillow, tuck it into their side. So that they're kind of propped up against it. The dummy kind of looks weird on it because she's very stiff. So she doesn't like fold into the pillow. And tuck everything underneath. Keep them covered as much as possible during this. Alright, and you're going to take another pillow. And you come over to this side, make sure that side rails up over there. She doesn't flip backwards or something weird. And then you're going to take this knee down here. Her legs are totally broken and stuff, but we use what we have to. Her legs should be tilted sideways. And then this leg up here needs to come up like this. So she's kind of clutching that. And then you're going to take your last pillow and put it under her arm, so she's kind of resting on it, kind of holding it as much as she possibly can as a dummy. Alright, when you're done with this, you typically check for a body alignment. It's easier to do this when you have an actual human being. So it should be her shoulder, her hip, and her one leg, so it should be a perfect line. And then you would do your standard pose steps, make sure that they're comfortable, give them their collar light, etc. And tuck them in. And that's how you do sideline. Alright, so I'm going to be transferring my resident. You would knock on their door first, and then you would enter the room. Introduce yourself, do your standard pre-steps. Line the wheelchair up with the bed as much as possible, so it's easier for them to get in. You would line it up with their strong side, so when they get out of the bed, it's easier for them to get into the wheelchair. You make sure to lock the wheelchair. This is very important, so the wheelchair doesn't go flying and they fall. Alright, we're going to transfer you. So for this, we're going to sit them up. Obviously, my patient can't do anything. For patients that can't do anything use a Hoyer lift, which is much easier, but we don't have one of those, so we're going to try and sit her up. She has a transfer belt on. Transfer belts are used for transferring patients, obviously. It needs to have room for 2 fingers to be able to go under. Alright. We're going to move her legs. Swing them over to the side of the bed. She's not very tall, so. Alright. We're going to make sure that she's wearing tennis shoes. We don't have any that fit her, so we're just going to pretend that she's wearing tennis shoes. Any kind of non-slip footwear is good, so socks that have grippies on them are good too. Alright, and we're going to stand you on the count of 3. I'm going to move you over to the wheelchair, okay? 1, 2, 3. And you would help them sit down in the wheelchair. Hopefully she doesn't take the bedding with her. And there we go. Remove the locks. Be able to go anywhere. Alright, let's go to bingo. Alright, how was bingo? Did you have a lot of fun? Win any money? Okay, I'm going to transfer you back to your bed now. We're going to lock the wheelchair. Don't want you falling. Alright, and then we're going to lift you. At the same time, also make sure she's still wearing her tennis shoes. She might have kicked them off for any particular reason. So, we're going to lift you on 1, 2, 3. I'm going to sit you back up on the bed. You're not very tall. Alright. And we'd swing her legs back onto the bed. And sit her back. Hopefully her arm won't is broken. Okay, well that's good enough. And we tuck her back in her covers. And do your standard post-ups like you always do. Be comfortable. And here's your call light. Call me if you need anything.